Okay, I think it's going. Okay. We just want to welcome everybody to our Nurse Talk Zoom tonight. And we're so excited. We're always excited with the guests that we have. And tonight we have a nurse. It's always good to hear from medical professionals. But again, as Doria and I tell everyone, this is not something you have to be medical about to do. It's just share your story, push play, show a video, use a tool, and connect people. It's really simple. We just love sharing it because as a nurse, that's our passion. So first of all, I want to disclose the disclaimers. So redox molecules do not diagnose, treat, or cure any disease. It just gives your body what it needs to help itself heal by increasing the cellular communication throughout your body. So we have a great night set up tonight with a great guest speaker. First of all, I want to show a short video by Dr. David Silverman that just explains a little bit of the technology. So I will go to share screen and we will get this rolling. Okay, let me find the one that I've got in there. Not it. Here we go.
My name is Dr. David Silverman. I'm happy to be able to spend a few minutes with you here. I'm on the medical board of this company, ASEA. I don't work for the company. It's a volunteer position. The flagship product, the breakthrough, is called ASEA, and that's the name of the company, ASEA. The technology is called redox. What's in this bottle is in us. Our cells make it. It's called redox signaling molecules. That's what it is. Redox stands for reductant and oxidant. It's made from saline. If you look at the back, it says it's made from salt and water. It is made from salt and water, but it's not salt and water anymore. What's in here, our cells make from saline. Our cells are filled with saline. When you go to the hospital and you get an IV, they give you saline because that's what our cells are filled with. Well, in our cells, we have something called the mitochondria. The mitochondria is called the power plant of the cell because we know it produces a molecule we burn for fuel called ATP, adenosine triphosphate. It's been known for decades. But during the complicated process of producing that, we also produce these little things called reductants and oxidants. When I was a biology major in the 80s and then pediatric medical school in the 80s, there was no known function for these reductants and oxidants. You look at the literature in the 90s, they've discovered a function. And they're called reductants and oxidants, or redox signaling molecules. And what they do is amplify signaling. They make it so that your cells can hear one another. Why is that important? Well, they're not chatting about the football game that happened. Cells need to talk about, need to inform each other if there's a problem with the cell, because bad cells need to be replaced with good ones. As we age, our cells die, they need to be replaced with good cells. Good cells, healthy cells in your pancreas, you got a healthy pancreas. You got bad cells, you're going to have a disease and they're going to start giving you medication to lower your blood sugar. Whether it's your cells in your retina, your liver, whatever, they die, they need to be replaced. They mutate, they need to be stopped. Who does all that? Your immune system does it. Your immune system gets a signal. It has to be a clear signal, and the immune system cells come down and get rid of that bad cell. All right? I'm not going to go into deep detail here, but this is why this product sounds too good to be true, but it is true because it's made from saline, right? And people are like, well, it's just salt water. It amplifies signaling. The more you have in your body, the louder the signal is. So children have a lot of mitochondria and they're very, very packed tightly and they're very efficient. So they produce a lot of ATP, power plant of the cell. Think about the energy children have, right? And as we age, energy kind of goes down, doesn't it? But what about healing? Who heals faster from an injury? A 10-year-old or a 20-year-old? 10-year-old does, because something happens at puberty. Our mitochondria become less efficient and we start producing less ATP and less of this. I'm 61 years old. My cells are making this much. They made this much when I was a kid, right? I could fall off my bike next day, go to school. Fall off your bike at 61, what happens to you? Well, my cells are making this much. I drink this, I raise my levels up. Simple explanation, much more detailed that you can get, and your friend can give you more resources. But safety was what I cared about. Because it's made from saline, it's not salt water anymore. Salt water is two molecules, sodium chloride and H2O. Redox molecules, there are 16 possible ones using sodium chloride, hydrogen, and oxygen. So in your cells, the sodium chloride molecules ripped apart, the H2O molecules ripped apart, and those ions are combined to make redox signaling molecules. But safety is important. This is what I love. Think about this. There's a money back guarantee on the product, so that's safe too, but safe to your body. You can't be allergic to it. It's in you. There's no toxicity. If you take too much of it, your body turns the excess back into saline. I used to write prescriptions every day. There's risks with prescriptions, lots, but there's no toxicity to it. You can't drink too much. And third, it's transparent to medication. So if you're taking medications, you don't have to stop. If you have low mood and the medication you're taking helped you, but you've got side effects, you'd rather not take it, you don't have to risk it and stop it. Just keep taking it and watch what happens with the change with this, just by this is the only variable. Now, the gel version is Renew 28. Now, this is fascinating. People want to know how that this is real, especially before they start telling people about it. Give this 90 days. A simple explanation how to do it. Your friend will explain how to use the product. Simple, easy. But the very first day you get the product, take the gel, and it's marketed for anti-aging. I mean, it rejuvenates skin cells. So it's clear. There's no smell. It's marketed for your skin. But there's something fascinating about it. So you have a 30-day money-back guarantee on the product. Find a few people that have something that hurts them. Maybe you have something, your neck hurts, your hand, I wonder if it could help your knee, your back, menstrual cramp, whatever it is. Find 5 people. Say you find 10 people. And there's a simple way to do this. And in 10 minutes, what if you put it on 10 people and in 10 minutes, 5 of them said, that's incredible. How did it do that? What if it was 7 out of 10? What if it was 9 out of 10? Your friend will share with you how to do that, okay? But please, I urge you, take this very seriously, this investigation. And once you see what it does and you're in the know, like the pioneers that your friend is, that I am, this is going to become mainstream in the world. And you put the gel on 10 people who are hurting and ask them how they feel in 10 minutes, it's going to be very self-evident to you that this is going to become mainstream. But you can share this with people. You can do the same thing your friend is doing. You can invite your friends to a Zoom like this, anywhere in the world, do the exact same thing. Play this exact same video. All you do is share what happened with you, and you can make a real difference in this world. So again, you'll thank your friend for the rest of your life that they brought this to you, and it's an honor to be part of it. I can't see you right now, but I know you're.
Whoops, didn't mean to do that. Hang on.
Listening to my words, and I hope you're taking this very, very seriously, because it really is a serious thing. Thank you so much.
Okay, let's stop the share. Whoops, hang on. Okay, well, we just proved that you don't have to be professionals to do this. Doria, I totally apologize. I lost my mind and my track of our program here. So usually we welcome everyone, and I introduced my wonderful cohort, Doria Stewart. She's a nurse from Atlanta area, and we're going to let her give her testimony. So this was her brainchild. So I thank her every day for doing this and pushing us both out of our comfort zone. So again, we're human, we fail, we make mistakes. Technology wise, it's not our thing. So anybody can do this, obviously. So Doria, I will let you give your testimony.
All righty. So yes, thank you, Cyndi. I'm so thankful that Cyndi said yes, because she's a wonderful co-host. She's the brains. I mean, she's literally brains. She's got the knowledge more than I do, even though I've been a nurse for 42 years. So it's because she's fresh on the market here after being a nurse for 9 years, I guess, or more. But anyway, this technology, as David Silverman was saying, and I'm so thankful that a friend of mine who is a trusted friend, a dentist here in Atlanta, Georgia, shared this technology with me about 4 years ago. And when he first talked to me about it, I thought, sounds really good. I am open to alternative, like, essential oils and chiropractic care and massage therapy, but I really didn't see a need for it for myself because I didn't have any major health challenges. I think I was deceiving myself, because being a nurse as long as I have, I've dealt with, joint discomfort, back discomfort, stress, lack of sleep, lack of energy. And so, I thought, okay, I'll go ahead and experience this product for about 90 days and see what it does. And I would say within the first 3 days, I slept through the night 8 hours without waking up. And I continue to do that. And it was 4 years for me on June 1st. All my discomfort in my joints and my back went away. I have more vitality, and I'm I'm going to say I'm 66 years old. So, and I am still working as a nurse. I love nursing. It's all about changing people's lives and being, making a difference in their lives. So, that's what it's done for me. I continue to see lots of little changes. I don't deal with any discomfort in my head anymore. I haven't had that in 4 years. I haven't had any issues with my sinuses. And that's a big problem here in Atlanta, Georgia. We have a high pollen count certain times of the year. And when everybody's sneezing and sniffling and having, watery eyes and things, then I'm not dealing with that. So I'm just very blessed. I'm blessed that my friend, Dr. Bill Williams, shared this with me. And it's a great product. It's a great culture. I'm so thankful that I got to meet Suzanne and Cyndi, and this is a great family to be a part of. So thank you, Cyndi.
Okay. Well, I am Cyndi Reed, and I'm a nurse here in Nashville, Tennessee. I actually work for a hospice company at the present time. And with my testimony, when I came across this technology, I was searching for alternative methods to help me with 4 autoimmune challenges that I had tested positive for. So I've been using the product for a little over 3.5 years, almost 4 years now. And at the time, I don't have any symptoms of any of the 4 challenges that I had. So that's a miracle in itself. And like Doria said, the sleep and the energy has really improved for me. And so this is something that I don't think either one of us will never stop taking. So it offers hope for so many people. And you're going to hear Suzanne give her story about hope as well. But Doria, I think one of the reasons I was so excited or so confused today is I'm so excited about the release of our new product, the Radiance, which is a product that actually gives your body all the amino acids and everything it needs to create its own collagen. It's vegan, no animal products in there, healthy, safe type of stuff. So I've just been kind of doing a little research into some of the ingredients, and we can talk about that on another Zoom, but it's very interesting and very intriguing. So Doria, I will let you introduce our guest speaker tonight, and afterwards we will have a time for questions and answers for Suzanne, and just really dig into this and listen to Suzanne's story and think about what this could possibly do for you or for someone you love, like David Silverman always says. Okay, Doria.
All right. So I have the pleasure to introduce to you Suzanne Truax. She's from Houston, Texas, and she has been a nurse for 40 years. And she sent me her bio, and it was one paragraph. And I thought, nope, there's more to this story than that little paragraph. So Suzanne, I want you first, I know you have a heart for the geriatric population. So has this always been an area of nursing that you spent your career in?
Well, it has been for the last 20 years, but before that, I started thinking today about all the things I've done in my nursing career. When I first started out, I was director of nursing for a private duty home care company. And so that's a company where someone comes and brings nurses to your home for someone often, that's bedbound. So I did that for a while. And then I went into the hospitals and did that for a little while. And I really didn't like that because often it was the patient in 324 that had a gallbladder removed. They weren't there long enough to even build a relationship. So that was not my favorite part of nursing. And I went into home care very, very early in my nursing career. And then I went back into one of the hospitals and worked with pediatric liver transplant babies and helped them to power through that kind of journey and help them to get back home safely. I also worked with VA patients and helped coordinate their care at home and worked at the huge VA hospital here in Houston. So I did that for a while also. And then I was director of the Visiting Nurse Association here in Houston. That was the oldest home care company in Texas. It was 101 years old. And I was director of that program for all of Harris and Fort Bend County. So that was 6 million people actually, and covered that big of an area. So I had nurses, I had physical therapists, I had occupational therapists that I coordinated care with their patients for them. And so that was a big job, lots of pressure. I was on call basically 24 hours a day. And that was in the days when you had pagers, right? That never stopped going off. So that was super stressful. And then in 1992, my husband was hurt in a car accident and was paralyzed. And the doctor, after his surgery, told me that he would never walk again. And I said, well, I don't know who you know, but I know somebody else, and I'm just not signing up for your class. So I took my husband out of the hospital and started looking for wellness technologies. And I discovered that there's many, many opportunities in the wellness world that many of the medical people don't know about. So I used some technology that were magnetics that helped his body wake up. And so I started on a journey then of teaching people about hope. So that was in 1992. And then in 2016, my friend Chris and Rhonda Gullo, who we had known for about 20 years, introduced us to ASEA. And that's when we started our ASEA journey.
So I understand that you were talking about your husband, and he was he in a motor vehicle accident? Is that what I'm
He was,
remember?
he
Okay.
was,
So
yes.
can you share a little bit about what that was like for him and how this technology impacted him?
Well, so even though that was back in 1992, as a person gets older, if they've ever had an injury, then it shows up again. So my husband had really bad neuropathy from the nerve damage in his spinal cord. And when we started using the ASEA, he was only taking a small amount of it. But then when he actually needed it for another situation in 2017. Can I share my screen just so I can share some pictures really quick?
Absolutely.
Okay. There we go. So for y'all that have never met my husband, this is my husband, Pat, and we've been married 42 years this year. And so I just want to tell y'all that, we live our life on purpose and to glorify the Lord. And so we feel like that ASEA has helped us to be more of servants for him. And I wanted to share, us nurses were talking a little bit earlier. We are all three very excited to be able to share this breakthrough. You'll hear over and over again about that this is a scientific breakthrough. The really wonderful thing is that there's so much science now to this breakthrough as the study of redox is becoming more and more mainstream. And there are so many universities now that are a part of these studies, these institutions, and whoever invited you to this call can provide you with some of those colleges. But this is part of my joy of sharing ASEA, because you can always share it with the hope of making a difference for someone. And Doria was asking me earlier about it. What would attract another nurse to this? If anyone is interested in seeing results and offering their patients hope, this is the technology. The reason that it's the technology is I know that all three of us, and especially you, Cyndi, in hospice, often it's the role of the nurse to be empathetic and then share news that's not always the news that a person wants to hear. So, yes, we all are going to pass away at some time in our life, but it doesn't have to be the same journey. And this technology can also bring comfort at the end of that journey. We've all seen it over and over and over again. And I'll share some stories with you about that too in a few minutes. But the studies help you to be able to document the changes that we see in people's bodies. This slide is actually talking about the Tourette's study that was done in 2017, that we know that in these 5 areas of our body, that we can expect a 20 to 31% change if people will take 8 ounces a day. And just in one incident, the hormone modulation, every single solitary person that I have offered this to that had a sugar issue, it has changed dramatically for them, dramatically. There's so many stories. We have a young lady named Daisy that's on our ASEA family team that was on an injection at night and 3 injections during the day. And she's now on only 1. And her A1C level is perfect. And so that's just one of those testimonies. I also love this because it helps to modulate the immune system, because often you'll run into people whose immune system is out of whack, either not enough or way too much. And so it's beautiful that this works like our own body works. It helps to balance, to modulate. The inflammatory response also can be way out of whack because the signal's not loud enough, like Dr. Silverman said, right? In our digestive function, we know that that not only affects our stomach, but in our intestines, but it also affects our brain, because we know that what's going on in our gut is also about brain health. And we really know that with people on the spectrum and people who have memory challenges. In the cardiovascular health, I'll share a story with you in a minute about that. So this is my husband in 2017. And this is when he had his aortic valve replaced. In 2017, in October, we found out that his aortic valve was basically dying. And we lived in a 2-story house that had 12 steps on a staircase, and he could only climb 6 of them without sitting on the landing and resting to climb the next 6. And we went to the cardiologist, and he said, you know, you're in a lot of trouble, and we're going to have to get that replaced immediately. Well, the world famous doctor that he wanted to perform that was going to Russia for a month. We also found out that Pat's carotid arteries were like 90% blocked. So they said, listen, you need to get your affairs in order. We don't know how this is all going to play out, but we need you to get your affairs in order, and the doctor will be ready for you in a month. So we had been taking ASEA, but we knew that it was non-toxic. The studies weren't completely out at that time, but I knew that it couldn't hurt him. So Pat started taking a bottle a day, and we did that for a whole month until the 2 days before his surgery. We went in for his his pre-op exams for his surgery. And he had no blockage whatsoever. It was completely cleared. And the doctor came in and told us that he was going to have an incision from, up here to way down yonder, way down there. Like we've all seen people who have had open heart surgery. Well, they decided to do a new procedure, and he only had an incision here on his chest from here to here. And they took the first rib and went in laterally instead of vertically this way. So he also told us that he was going to have a pacemaker, and he would come home on 15 medications in about 3 weeks. So you see this, this is the first 24 hours that he was awake. And I just kept taking pouches in there. And when they would let me in there every 2 hours, he got a pouch of ASEA. And so he came home in about 10 days. He did not have a pacemaker. The doctor said his heart was incredibly strong. So he did not need the pacemaker. He came home on 2 medications, and his recovery was remarkable. And the doctor just shook his head and said, "What did you do?" And Pat said, "I don't know," because he was sleeping, you know. So I told his physician about it. He was very excited about it and said, "You're a great wife." And that's about what he had to say about it. But it was great because I was able to just, you know, bring it to the hospital. And also, I put the ASEA in a spray bottle and I sprayed it on his chest all the time. We used the Renew 28 also. And then his incision was covered with one of those waterproof bandages. So I just put Renew around the edges of it. And then as soon as they took that bandage off, we started covering it with the gel. And if my funny husband was here right now, he would show you his chest because he never, ever, ever had a scar. There was never a scar there. It never materialized. You can't even see where the incisions, where the needle, where the threads were. There's absolutely no scar on his chest. So I was very, very thankful that we had that technology then, as we are every single day now. So that's why I'm very passionate, because I see day after day the miracles that this product and technology can offer people. So that's that story. And so after that, and he recovered, we sold our 4,000 square foot home in Sugar Land. And this is a 45-foot Allegro bus. It's as big as a city bus. And we live in it full time. And we live here in Houston near the medical center. And the reason we live here is because my husband and I really felt like it was a place that we could be a servant to the Lord and to share ASEA with other people. And with my nursing, I could help people. This RV park is connected to the medical center here, where many people are here fighting the rogue cell situation. Many people are here waiting for maybe a liver transplant or a heart transplant. And so there's a lot of wonderful people that we've met here that we're really great friends with now. So it's a beautiful lifestyle, and we get to travel. And now, because of our ASEA business, we really get to travel all over the world. And this is our little granddaughter that's in Australia right now, and she was born there, but they'll be back here in a few months. And these are the rest of our grandkids. So I just wanted to share that with you. And this is my my life right now as nursing. So this is me in my uniform, and my husband and my son and I also own a mobile X-ray company. And so we do X-rays, we go to people's homes, we do EKGs, and we also do ultrasounds in their home. And so it's a way to help people be proactive and for us to have other people that we can help in the community. And this other picture is me at a camp that I do in the summer. This is a superhero shirt with my RN super hero cape on. And that's what I do in the summertime. So that's what I'm doing right now. And we are really, really loving it.
Yeah, that's wonderful. So I have a question. You didn't mention anything about discomfort, because I know when you have this surgery, there's a lot of discomfort related to it. So what was that like for him? Did he have any discomfort post-operatively?
He did, and it was a lot of nerve pain. It was tremendous nerve pain, and they started him on a medication that we didn't like the side effects from it. And if I told both of you, you'd know why. But anyway, yes, it was super, super helpful, especially the gel. The gel was super helpful. And like I was saying, when he had his spinal cord injury, the neuropathy was tremendous from that injury, and it has helped incredibly, incredibly.
And then how often were you putting that on? Like, would you say the gel for the scarring, the scar that he had on his chest? How often
Oh,
was
several
that?
times a day, because it was a combined effort.
Mhm.
The nerve pain was from that area. So I was doing it for the pain and the discomfort, excuse me, the discomfort. And but it was doing both things. It was repairing the tissue on the outside, because we know with the gel it becomes systemic, right? The skin is just the doorway, because what we're doing is we're increasing the redox. We're not just making that little place better or that pain go away, that discomfort go away, but we're adding more redox. And of course, when your body has been attacked like that with just the anesthesia alone, he was on the heart machine for 8 hours. So just think of all the stress that that causes, and all the impurities that are put in the body while they're trying to repair it. Is typically it takes like 6 months to get that anesthesia out of your body. And so that's why, again, if you've ever had any kind of surgery where you've been under anesthesia, it's really, really important to get the redox on board to get the impurity out of the body, and to start the repair and keep the repair going.
Wow. I'm surprised, I guess the doctor, when he said, was surprised about his progress, and, what he said, I guess he didn't know what else to say, I guess, but
Right,
you able
because
to,
he was so
yeah.
flabbergasted. He was. He was. He's a very,
Mhm.
very kind man, and he knows that we do things like that. And so, you know,
Wonderful.
he was kind about
Um,
it.
there was another question. Cindy, do you have a question? I had it one, but I don't remember it now. Go ahead.
I always ask this question. So Suzanne, at this point, how much are you and your husband drinking a day of the redox?
I do 8 and he does 12.
Okay.
Because
Um,
as we all know, we're all getting older,
right,
right?
exactly. So we have to
Yeah,
increase that along the way somewhere.
absolutely. Yes,
Yeah. Are
yes,
you
yes.
finding that when most people you talk to through the avenue that you're going, are they interested or open to this technology being something
Oh,
outside the
yes.
box?
Yes. Yes, they are.
Awesome.
Yes, they are.
And that's the thing, as we start digging into alternative ways, like you said, most traditional doctors don't realize what's out there because they've been trained a certain way and they never venture outside of that box. But there are so many things. There's things like hyperbaric oxygen therapy. There's, red light therapy. There's infrared saunas. There's so much.
Laser.
And even
Yeah,
things, yes, I don't even know about. I have a friend that's always telling me the newest thing she's doing, and it just blows my mind, all the stuff out there. I mean,
right. It
yeah, and
is.
a lot of it works in combination, but you've got to have, it's like we talked about with, even with your diet, you can eat the finest foods, you can take the finest supplements. But again, if you don't have that cellular communication in your body, it's really a waste of your money and your time. So redox is kind of the foundation of anything else we could possibly do for our health.
Right. Well, and when you're talking to people about this, just asking them if you want to improve,
Right.
right? We all want to listen with a kind heart. Sometimes people want to improve, and sometimes that they've settled,
Mhm.
and you can just love them where they're at. And that's the part that's difficult sometimes, because when you love them and you know that there's something that could truly make a difference. I was going to share with y'all as gently as I can. It is sad sometimes that people come to you at the last minute, and need help. And many times, as you do, Cyndi, is that you help them at the end of their journey. And several weeks ago, a friend approached me about his friend that was at a certain hospital here in Houston, and asked me if I could go to the hospital and take some ASEA and Renew 28 and teach his wife, how to use it. And so, as I shared with you earlier, I put on my nursing uniform with my name on it and just
Mhm.
walked in the hospital and nobody said a word about it. And so he did pass away 3 days later. But when I was there with him, he was completely alert, completely alert. And he did not have his kidneys had already shut down. His blood pressure was very, very low. His numbers on the breathing machine were very, very low. And I cleaned his mouth with a little toothette dipped in a sea because he was intubated through his mouth and had, his mouth needed cleaning. I'll just say that. So I cleaned his mouth with a little toothette that I had dipped in a sea. And I also rubbed Renew 28 on the bottom of his feet. And I sprayed ASEA all over his torso. And I taught his wife how to do that. So I was there for like 2 hours. The next morning, his kidneys started working again. His catheter bag had had no urine in it for 48 hours. And the next morning, his catheter bag was full. His blood pressure was 120/70. And his oxygen saturation was normal.
Wow.
So when you see things like that, you can't negate what is going on here, right?
Right.
And the more you share this with people, the more you realize that can be the norm. So it's about sharing, it's about using the product, it's about pushing it to its limits. And I'm just going to jump right out there and say, we know where this product came from, right? Because the man who's perfect here is the one that put it in our bodies from the beginning, right? And so we know that redox molecules work, right? It's just a matter of adding more. So when a person's in crises, right, you can add more redox. And if even it's the end of life, the comfort that it's brought by adding those redox molecules will change your life and the person you're sharing it with.
Suzanne, you mentioned like the end of life with that patient. The sad part about my job, I can't share that with my patients because of the conflict of interest. So I'm not allowed to do that. I wish I could step into your shoes or out of this realm where I could just freely go and talk to people that might be at that stage of life, because that's the hard part, doing what I do and knowing what I know, that this could help. I mean, even like you just proved, just a little bit of improvement for the last few days, that's worth a lot for the family as well as the patient, and that this could possibly help. No one is past possible hope with any type of improvement, with this.
Right.
But it's just been a challenge for me to deal with that.
I'm sure it is. I'm sure it is. Yeah, I tell people all the time I'm unemployable. And I have been for since 1996.
Well, that's
Because
actually a good thing.
it is a good thing. It is a good thing. I was telling my friends that I was working with today, I said, this is my only employment, and my only employment every year is getting to be a servant at the school and being a school nurse, because they pay me a little bit, but the joy is all mine.
Right. Well, the thing about this business, and Doria and I'm sure Doria agrees too, is the fact that we're building our dreams and we're helping other people build their dreams instead of working for corporate America and building a corporation, totally
Right.
different environment.
Well, right. And being the person that you can be, right?
Right.
And that's just the way it is, right? Yeah. So hopefully you can carve out time, though, that you're still helping people in that same situation.
Right.
Yeah.
Yeah, I do.
Yeah. That's great.
That's awesome. So I just have one last question. So I know you're going into the hospitals, and are these people that know you because you have worked there and you have relationships with them when you go into the medical center in Houston?
No,
Okay.
no, the
So,
last 3 times have been people who, one lady in a Facebook group said, it's a mom's group here in Houston. And this one mom said, I have a baby. Every time she gets a mosquito bite, it turns into something terrible. Does anybody know anything that could help? And this other lady shows them a picture of Renew 28. And she says, I don't sell this. I don't know where you can get it. I said, oh, let me PM you and tell you where you can get it. So that lady reached out to me and I said, this is divine. We have to have coffee. And so her daughter was sick a few weeks ago in ICU here in Houston. So I went to see her daughter and at a hospital here in Houston in the medical center. And I just put on my uniform and walked right into ICU with my ICU and my Renew 28.
incredible.
That's awesome.
I was just going to ask you, so if you're walking down the hall and let's say you meet Cyndi, she's working as a nurse. How would you approach her?
I probably wouldn't.
Okay.
I probably
So you're
would
not
not.
you're not talking to other nurses, you're just
I
talking to
absolutely
patients.
know. Yeah,
Okay.
yeah. And they're people that their family have invited me up there,
Okay.
for the purpose of doing exactly that. I've
Okay.
had 3 people in the last 2 weeks ask me to come to the hospital and teach their family members how to use ASEA
Okay.
and Renew
awesome.
28. Yeah.
Awesome.
But 18 months ago, that probably just because of that we weren't we weren't as far advanced away from the situation we were in. I think it's partially the times, but also the fact that just one day I decided I'd put on my uniform again that I hadn't had on since like 1996. And I wear that sometimes when I'm marketing for my x-ray company too. But it's has allowed me leverage to to go in places that I probably wouldn't have gone before. But that's kind of a sidebar to what I was talking about though, Cyndi, about having confidence. The more you use the products, the more miracles you see,
Right.
the more it boosts your own confidence of talking to people, because it's all in your delivery.
Right.
It's great to say, oh, watch this testimony, and those are great, because everybody doesn't have the same experience as I have. They certainly don't have the same personality. My husband will tell you that I'll walk up and rub men's back with the Renew 28, and he's like, yeah, that's my wife, all right. But everybody doesn't do that or can get away with that. But I still, the more you use it and the more comfortable you become, the more that people realize you're serious about your belief and your knowledge and confidence in the product.
Exactly.
Excellent.
Exactly. Doria,
We
do you
do
want
want
us
to
to
put
open?
that disclaimer back in, all these wonderful testimonies that you've shared. Again, redox or ASEA redox is not intended to treat, cure, any medical condition, but like what she said is you're replenishing those cells with the molecules, and so the body's healing itself. Just want to put that
Right. And
disclaimer in.
communicating itself with
Mhm.
itself, right?
Right.
Yes.
Yeah, because like you said, that gentleman wasn't cured, but his organs started working again because of communication, right?
Right. If you want to, we'll open it up for any questions. If anyone has questions for Suzanne, raise your hand and or unmute, and we will have a question and answer time. Who is that, Barbara?
I believe so.
Hi, thank you so much for sharing all that. That was so amazing. I wondered, after your husband's surgery, I know you said his pain level was really high. Did you take any medications, or did you just use the redox technology?
I think, well, when he was still in the hospital, certainly he did. But when we came home, no.
Awesome. Thank you.
Sure.
Any other questions?
There was a long comment in the chats, but I couldn't,
Let me open the chat here.
yeah.
So I was trying to.
Did I just close it? Hang on. I just closed it down. I see several comments.
I think Kirk has his hand raised. Kirk.
Kurt,
Woolheater.
okay,
He
yeah.
does,
Go ahead,
yeah.
Kurt. Unmute, Kurt. Go ahead. You're muted.
I can tell he's walking around. Looks like.
He's got his hand raised.
Yeah, gotta unmute, Kurt.
Okay, there we go.
Okay.
Sorry about that.
Hi.
Okay.
It is so powerful to hear that, you know, my nurse was Karen, that the nurses at UT would not, you know, some of them would leave the room, some of them would learn and be interested, and, you know, but that's, you know, they're not there to doctor, they're not there. And I, you know, hate that, Cyndi, you know, that you can't share with, you know, what you could share with the families of the patients that you're caring for, is that what it could do for them,
Yeah, I have gone around and kind of done a few things like that.
for their mental state, because,
Mhm.
you know, the depression, the stress, you know,
Mhm.
and like, you know, Karen and I were, with all of her pain, you know, she's been, you know, when she was ejected out of that rollover and ripped her left arm from her body, but, you know, inside the skin, and she's had no surgeries. You know, she was losing, you know, function because of hydrocodone,
Mhm.
and, you know, CBD helped her get off of that. And, you know,
Mhm.
we were going through, you know, several $100s worth of CBD a month just to keep, just for her to keep going, to be able to, you know, and now she's, you know, back to working and enjoying herself, you know, not being my caregiver, and getting some time and helping friends get their bar straightened out. And she's always wanting to do that, and she to be in that industry, and she's never been in it. She's doing a phenomenal job.
Mhm.
But yeah, but her putting it on, the, you know, when I had the wound vac and all of that, it was just absolutely, you know, absolutely amazing, you know, what
Mhm.
you have to do to take your life and your care into your own hands. Thanks for
Yes.
listening.
That's true, Kurt, and we appreciate that. And Kurt and
Thank
Karen,
you.
his wife, will actually be our guest speakers on for next week, so everyone join that as well. I think I found the chat. Candy actually had a question. Was that the one you think you saw, Suzanne?
Probably,
Question about our
yes,
grandson. Candy, do you want to
yes.
come on?
Yeah, here, let me pull up my video. You know, I have a question regarding my grandson. He's 15 now, and since he was born, he's had this problem where to empty his bladder, he's had to use a catheter. They finally last week went in and did an augmentation on the bladder and everything else. And they went in and with different tests found that there's a problem with the kidneys, and they're saying that he has to have a kidneys transplant. Now, knowing what redox will do, I know it'll help, but I'm trying to figure out how to get my daughter, because she won't listen anyway and stuff. She's OR surgery tech and stuff, to get them to use the redox, or how will this help in working with the doctors and everything else to help to where he doesn't have to do a kidney transplant? You know what I'm asking here?
Sure, you're a grandmother who's desperate to help her grandson and have a stubborn family member. And you're not the only one.
You got it.
I have a daughter-in-law that still thinks this is pool water, and she is also an OR nurse. And I might as well be talking to the kitchen sink in there.
Yeah.
It's a challenge. Because, you know, partially, it's coming from the family, right? So who are you to know, right? It's always that thing, right? I don't know. I wish I had some magic. Yeah, it's hard.
Okay. I just,
Candy, maybe just,
just keep praying, and
Yes.
that's all I know. I've been sending out different things on with Donna Lynn's group, redox midwives and stuff, just asking for prayer. I just know that with all of the other testimonies, like with your husband and all of it, that I just know it would help.
Well, I do also know that over and over again, I have seen people with kidney problems that even, I had a septic knee at one time and was on Rocephin and vancomycin. And both of those IV antibiotics are like toxin to the kidneys. They're as bad, if not worse, than chemotherapy. And by taking a lot of the redox when I was taking the IVs, I saved my kidneys because we saw the numbers going down and we saw them coming back up. And that's not an isolated situation with myself. I've seen it over and over again.
Okay. I'll send that to her.
Candy,
Okay.
is he close to you? Is he in the same town with you?
No, I'm down here in Texas and he's up in Clarkston, Washington, and
Oh, okay.
he has to go to Spokane to have this surgery, and then he's going to have to go to Seattle to do, if he does have to have the transplant, he'll have to go to Seattle for it.
I just thought if you were close and you had access to him, just apply the gel to him. Just tell the daughter-in-law, just say, this won't hurt him, at least put it on. There's nothing toxic. There's no interfering with anything he's already doing. What do you have to lose? Just try it.
Okay.
I don't know if she will. Yeah, and most of the people I share with that are nurses, friends or family, those are the hardest ones to convince because they're medical and this is not in the normal medical realm. Those are the ones I struggle with. I mean, I have tons of medical friends. Yeah, it's a challenge, but fortunately, I was not one of those people. I was very open to this and willing to look for something different because I was already on that pathway.
Okay. All right. Thanks, everyone.
Yeah.
Appreciate it.
Any other questions? Any other questions from anyone? Do you see anything else in the chat, Doria?
No, I mean, Kirk still has his hand up, so I'm not sure if he has another question or not. If he, oops.
Kurt, do you have another question? He's still muted. I don't know.
Oh, how about now?
Yeah, there you are.
Okay, well, when we went to the Ascent trip in Spokane, and with all the people in Washington that are, Dr. Dick Walker, Jerry White, that, the San Antonio Ascent was great at, being 2 weeks post surgery from reconstructing my left foot, when we went to San Antonio and being in the wheelchair. But going to Washington and the community, our Lyft driver that picked us up in the airport, at the airport, to take us to the hotel was under, she was inactive, but she was under Dick Walker
Oh.
or Jerry White or somebody. And she was gonna come to the event, but she was don't but the community up there, when you go, just one thing, listening to Denny Robinson and all the speakers and being there and getting, but the community there in Spokane and Seattle, you reach out to any of them, and they can help, that they are their local. And somebody, I mean, my daughter's in Seattle. They get their case every month there, but they wouldn't use it. they have a problem with their, you know, pet, that she has bad separation anxiety and always has stomach issues and on all this. Once my we call her my sister-in-law, she's my son-in-law's mother.
Mhm.
She's the nurse in Florida. Once she started taking this and got results in, you know, 3 weeks from being in chronic pain, and now she's back to gardening and riding her bike, and the kids call us. We're going to start giving the ASEA to Lady, and we're going to start taking it ourselves. They wouldn't listen to us. It
Right.
saved my life, put me back on my feet. And when I had a stroke, able to, you know, when I came off of dialysis from and had a stroke and was mumbling and sat here and took the, you know, a drink of ASEA within 5 minutes and was speaking, you know, fairly normal for a plumber.
Mm.
You've always got to have that, you know, let people know you are a plumber when you're talking to them, so they give you a little bit of grace. But you know, the kids, you know, hearing it from her and not us, and all I saw was her talking about her pain on Facebook, and we reached out to her, and she, you know, listened to us because she was at that point, you know, that point of desperation.
Mm.
And so, you know, you have to, you know, implore people that, you know, if it takes going over there and and you know, just short of kidnapping that grandson, but yes, it could help him, you know, it with all of my issues. I mean, I was dead set on working myself to death in this. But anyway, we'll get into that next week. Love y'all. Have a great night.
Thank you, Kurt. Appreciate
Thank you,
that.
Kurt. Yeah.
Yeah, his amazing story. If there's no other questions, we will end the Zoom. And Suzanne, we appreciate you coming on so much. This has
You're
been
welcome.
a blessing for so many, and I'm sure the ones that were on have listened. Hopefully we'll take something away and go back and share this with anyone they know.
Thank y'all.
So thank you. And everyone join us next week as we have Kurt and Karen on, as we talked about, and here both of them have pretty amazing stories. You won't want to miss that one as well. So if there's nothing else tonight, we will end. I'll go ahead and stop our recording. There we go.